Hi, this is Stacy Collins with the Ohio Department of Developmental Disabilities. I'm the Community Life Engagement Manager within the Policy and Strategic Direction Division. I'm here today to talk with you about resources that are available to our stakeholders across the state, as well as wanting to review with you some flexibility we have within our services. Want to make sure that you know that DODD has set up a dedicated web page for department communications and links to helpful resources that will help advise people with disabilities, their families, service providers, and direct support professionals, county boards of developmental disabilities, and the community at large. So please make sure that you have visited dodd.ohio.gov to access resources and communications that would be helpful for you. Additionally, DODD has set up a support team that consists of staff ready to help county boards of developmental disabilities and providers around health and safety, supportive technology, adult day support services, and employment support services, adults and youth with dual diagnosis of mental illness and intellectual disabilities, behavioral support and multi-system youth, early intervention, community and residential services, and individual service plans, service coordination, and provider support. You can learn more about the DODD support teams by visiting dodd.ohio.gov. Additionally, today I would like to review with you some guidance that the department has sent out regarding the adult day and employment services to really make sure as a system we are allowing service flexibility so that we all can come together during this time of adversity to ensure our entire workforce is supporting individuals with developmental disabilities and their families. The department is working to make rules and regulations as flexible as possible, so it's the focus on all of our teams are the people we serve to ensure health, safety, and wellness. The focus of the efforts I'm going to discuss with you today are to redeploy direct support professionals providing the adult day support and vocational habilitation service, as well as to increase flexibility in onboarding requirements to increase our workforce right now during this time. The first part that I would like to review with you is regarding the requirement flexibility for the adult day support and vocational habilitation services. Within requirements and rules, the Department of Developmental Disabilities is allowing the adult day support and vocational habilitation service to be provided in any HCBS residential settings. These services, adult day support and vocational habilitation, can happen in an individual's home. Additionally, if an actual adult day support and vocational habilitation services provider is not wanting to go into somebody's home to provide the adult day support or vocational habilitation service, there are alternative options for that provider to still continue to support individuals. I'm going to go over these options with you. If an adult day support or vocational habilitation service provider is already certified to deliver homemaker personal care services, that provider can begin to provide homemaker personal care services and be able to bill for those services. Of course, we ask that in order to step in for those services, that the provider communicates with the individual, their guardian, as well as their service and support administrator with the county board. If the adult day support and vocational habilitation service provider is not certified to provide homemaker personal care services, providers do have other options as well. The first is that those adult day support and vocational habilitation service providers can subcontract with residential providers to provide both homemaker personal care services and or respite services. Additionally, if we have an adult day support or vocational habilitation provider, if they do not want to subcontract with a current residential provider, they can apply to become certified in the homemaker personal care service. In order to do this, providers must go to the Department of Developmental Disabilities website and the Provider Services Management Tool, or PSM, to add the homemaker personal care service to their existing certification. It's going to be important for a provider who does want to do this option to use the communicate feature within PSM to alert the department that your application request to add HPC is in there, and DODD will expedite that process and that request. Additionally, to allow more flexibility, we are encouraging our providers to continue to look at alternative service options and how those service options can be used in a different way to support individuals across Ohio. One of those services is remote support services and being able to use that to support individuals in their homes. The next thing I would like to review with you is around new employee onboarding. The Department of Developmental Disabilities has been working to change rules and requirements pretty quickly over the last couple weeks, and another piece is around new employee requirements. The department has been putting efforts in place to relax requirements so that direct support professionals or new direct support professionals can begin service delivery more quickly. Within our guidance documents that we've shared, we've talked about an alternative workforce and provider agencies being able to explore college students or individuals without high school diplomas or GEDs to do services during this time. Additionally, the department has guidance out around condensed training requirements to allow individuals to start services more quickly. Providers are still required to provide MUI or major unusual incident and universal precautions trainings for their direct support professionals, but that training can be condensed. Additionally, we're encouraging the sharing of direct support professionals amongst agencies and the ability to share staff to support individuals. Whoever is the main employer of a direct support professional and with that sharing of staff must ensure a statement is provided to the other agency just indicating that all training was completed. But there can be that sharing of direct support professionals amongst agencies, again, to make sure that we are ensuring the health, safety, and wellness of the individuals across Ohio. Within the guidance as well, providers do have flexibility or have the ability to initiate background checks. So providers will still need to initiate appropriate background checks, driver's abstract if an individual will be driving, and required registry checks. After these checks were initiated, the actual person can begin services immediately and can begin to be put on the schedule to deliver services. We wanted to point out that RATBAC is not required for our direct support professionals to begin service unless the position will be maintained after June 1st of 2020. There is additional flexibility within onboarding requirements and within services that I didn't go over with you today, so please make sure that you visit dodd.ohio.gov and you visit the COVID-19 resources and support page, and all of our guidance and materials are there for you. We know it's really important that our system and our teams come together to support the individuals and families across Ohio. The current time in our system does require intense partnership, and we are strong. It's our goal to ensure our system is flexible to allow providers to continue the very important services we offer in Ohio. And we encourage you to keep connected to the Department of Developmental Disabilities by visiting dodd.ohio.gov and joining our mailing lists. Communication is coming out daily regarding service flexibility and options that providers, individuals and families and our county boards and our many stakeholders have.
Hello, my name is Debbie Hoffine, and I oversee the Medicaid division within DODD. DODD recognizes that providers of adult day, vocational habilitation, employment services, and non-medical transportation will likely experience financial disruptions during this state of emergency, as a good portion of their revenue is Medicaid reimbursement that is generated by the delivery of services to Medicaid-eligible individuals. With that in mind, DODD is making a payment to these providers outside of the Medicaid claims process. These payments are expected to be deposited into providers' accounts on Tuesday for those who receive their payments through electronic funds transfer or direct deposit. Paper checks will be mailed to those who do not utilize electronic funds transfer. These payments approximate the average amount that these providers would normally receive through Medicaid claims reimbursement for a 2-week period of service delivery. The intent of these payments is to allow providers time to adjust and prepare for the temporary impact to their revenue that might result from the reduction in the number of individuals who are receiving these types of services during the state of emergency. The intent of these payments is also to allow time for DODD, Ohio's county boards of DD, and the provider community to work together to plan and strategize ways to continue to get needed services delivered to individuals with developmental disabilities, and to allow for Medicaid to continue to be a viable source of revenue. Additionally, it allows time for all to better understand how various sources of emergency funding may be accessed and utilized to sustain the DD provider community as a whole. Providers should continue to bill for services delivered to Medicaid-eligible individuals through DODD's electronic Medicaid billing system. The billing system is available and fully functioning. Additionally, standard claims edits that require services to be fully authorized through the Payment Authorization for Waiver Services system, which is also known as PAWS, are being relaxed to allow for minimal disruption to claims reimbursement. It is anticipated that many needed services will be authorized by County Board Service and Support Administrators by phone or by email, and DODD is prepared to honor those authorizations without the traditionally required updates to the PAWS for the individual. Please direct questions regarding claims reimbursement to the DD Provider Hotline at 1-800-617-6733. Thank you.